A very good morning, ladies and gentlemen, and to all you lovely people who've joined us for the biggest virtual implantology event of 2020. My name is Ruben Lobo, and on behalf of Team DentistChannel.Online, I warmly invite you to another presentation. Ladies and gentlemen, we have with us the digital doctor in India, the person who's a synonymous name when it comes to the Indian Prosthodontic Society, as well as to the person who's the go-to guy when it comes to digital dentistry in India. A person you've all seen, all know, and a person who's a name synonymous when it comes to digital dentistry. Yes, ladies and gentlemen, I'm talking about our very one and only Dr. Kartik Bhanushali. Dr. Kartik Bhanushali, before I go to introduce him, it's my pleasure to tell you that Dr. Kartik Bhanushali is one of the well-wishers, one of our good friends, and of course, one of those people who would never say no when it comes to DentistChannel.Online. Whenever we have a request with Dr. Kartik Bhanushali, he makes sure that he is winding up his appointments soon so that he can patiently listen to us and to say yes to everything. Dr. Kartik, we can never be more happy than you being there for us, you being there by our side today, always, and forever. Thank you, Dr. Kartik, once again for joining us for this session. Ladies and gentlemen, a short introduction about Dr. Kartik Bhanushali. Dr. Kartik is a consulting implantologist to various groups of dental clinics in Mumbai, India. He pursued his BDS from CSMSS Dental Hospital, Aurangabad, India. After graduation, he spent a year as an assistant to specialty orthodontic practice, learning orthodontic applications before obtaining a master's degree in prosthetic dentistry from the Government Dental College and Hospital in Aurangabad, India. He then received a certification in implantology from the Hamburg University, Germany. Besides being in private practice, he has always been an academician in dentistry, starting at the D.Y. Patil Dental School from the year 2001 to the year 2004. Later, he was the director of the D.Y. Patil Dental School, Pune, after which he was the clinical associate professor of prosthodontics at the same university. He has shared his knowledge and has participated in many continuing education programs in Europe and Copenhagen with 3Shape Academy since the year 2004 in various aspects of digital dentistry, ranging from scanning to designing and specialized software like Implant Studio. He loves to keep himself updated with the latest technological advancements in dentistry. He has fair knowledge in machine learning and production and is well versed with Lyra ETK, a dental implant and prosthetic solution from France. Dr. Karthik has been placing and restoring dental implants for over 2 decades now. His practice in recent years has become more and more centered around implant and dental rehabilitation. He is the publisher and the editor of the Indian Academy of Digital Dentistry, a group devoted to digital dentistry, regeneration, technology, and rehabilitation. Ladies and gentlemen, presenting to you Dr. Kartik Bhanushali live.
Morning. Good morning, everyone. Thank you, Ruben, for such a nice introduction. Uh, Today, we are going to talk more about open and scalable dental solution. I am glad that the team is there and everyone from the team is also on board. Welcome you all. And today's topic will center around how we can uh, utilize digital dentistry and scale it up. Scaling means growing, and growing means joining dots. Open and scalable production system is a system where industry framework for integration of clinical production with existing lab production. So you can scale up your clinical production with the lab production in the way you want to join these dots and rods and grow higher and higher as you progress further. So you are not limited by what you can do in your clinic alone. Now that's the whole goal of scaling up with digital dentistry. We begin with analog dentistry, and scanning is the most important first step towards getting into digital dentistry. A superior scanning technology is the most important thing, and then it has to be supported with a ecosystem of softwares, ecosystem of designing, and also production capacities. With this much in-house, you can go beyond by doing more, adding more into your practice with better diagnostic, using this scanning as a diagnostic aids also, and creating preventive dental restorations. So you have to go from analog, from scanning to scanning, and from scanning and production to further going and creating a better use of technology. With Reshape various apps, like you have apps in iPhone, you can now add up with various design softwares of your interest, including Trio's Design Studio. Then Implant Studio is one of my favorite one, which can help you scale up in implantology by not only doing your own guide planning of a case, but also creating your own restorative solutions. Further, you can collaborate with your existing laboratories or production houses who can support in your design productions. Splint studios, clear aligner studios, indirect bonding studios. These are all new apps which are collaborating orthodontics with digital dentistry. So digital dentistry is going way beyond only doing crown and bridges in your clinic, and it is uh, completely in creating an ecosystem where nothing is left behind. The latest is also denture manufacturing. So we are talking today about point of care manufacturing. That is, you make your crowns and bridges in house. Now, the advantage are for both benefits for patients and doctors, and there is more benefits to the doctors. You will have freedom of choice. You will optimize your time and money, and you will have full control over the treatment. Whereas patients will get to get their work done in less visits, as we all know, in today's time, it's difficult to do commission, and also everybody is looking for the best quick solution for their problems. You can make a call, like if you want to do in-house, you can limit yourself with crowns, veneers, inlays, onlays, up to 3 unit bridge, which forms maybe around 60% of your practice, and anything more than that which you don't have capabilities to make in-house, you can collaborate with your labs and send it to them for supporting you in manufacturing your bridges, full arch, posterior, anterior frameworks, and all other restorations. uh, Digital dentistry is not going to get limited with the labs too. Eventually, there are special milling centers, special 3D printing centers with whom you can collaborate and get your designs customized for your case. So, what you should consider as a new user? A new dental user should start doing scanning first. Once you are well versed with the scanning and supported software for scanning and comfortable to go into the designing mode after say 3 or 4 months of your scanning practice, then you can start designing your own restorations. Start with small restorations, inlays, onlays, veneer, single crowns, and then designing. Once you are designing it, you can opt to start milling them in house. Once you are getting expert in your CAD CAM, then further you can see what best you can take out of this uh, structure you have and collaborate with laboratories to do better work. The chairside workflow is very simple. You scan, you design, and you produce. Produce with the machines or mills which are integrated and validated with the software. Now, with this open solution, you get world's best scanning, You get powerful ecosystem. That is, you can collaborate with various softwares. Also, you need not have to buy all the full software suite. You can use the one which you want to use and work with CAD points. So every time you want to do a new design, you have a software backup, and then you can start doing the, say, you do removable partial dentures rarely. So you can just buy the CAD points and do the partial dentures design as per your case, and then forward it to your production lab. So this way it reduces lot of differences in opinions and situations where the things don't fit because you want it this way and the designer is doing the other way. So you have to take control of the designing in your hand. Then integration with the mill, you also have choice to do it in-house, or you can send everything outside to the laboratory. Wireless innovation is awesome. Like you can take this scanner, move in your operatory from one unit to another, and you can scale up your operations from one case to many cases in a day. So, of course, with this pandemic, you have to be very cautious about the sterilization and cross contamination. So the tips are autoclavable, but yes, you have to take care of other things also. And the scan is also AI based. So every time you are scanning, it is getting improved, and the unwanted features are automatically eliminated. And it also has now trios patient specific movement. So you can actually send your patient's data with the jaws in motion. So you get a dynamic occlusion, and your crowns will have less likely to have the lateral high point. The proof is the publications. There are various publications which have time again and again proved that this intraoral scanning is superior to dentistry. You can go to the website and check for the better publications there. Okay, this once you have done your scanning, the software is getting intuitive with AI-based suggestions for you. So if you are in a say situation where you don't know what to do, there is easy notifications and hints that okay, you can control this design by doing this, and then your design work is completed. It is as good as a hand holding for you while you are designing. It's just only that you have to attempt. The rest all the machine will keep on, the software will keep on hinting you. Now that's the best feature I can say, which is making the designing part uh, a very easy process. I have doctors, of course, they are also right now. We all have been working. So beginning designing is always a question for everyone. Who will design for me? Of course, there are, you can outsource your design work to designing centers, but nevertheless, for everything it takes time. So if you can design your own work the way you want for your patient, because you have seen the clinical patient, and doing something on the model, correlating it with the patient's intraoral situation is what the real uh, issue. So this helps you in creating fast customized designs, and you can further go for production in-house. So in the chair side, you can do these various crowns, bridges, inlays, onlays, veneers, screw retained crowns on your implant restoration. The very important application for today's and very profitable also. So these are the new entries which are making life more and more simple and advantageous for both you and the patient. You can also have uh, various softwares for designing customized abutments, and they are all integrated with the validated CAM machines. So we have various machines. So it's an open system. So it has validated multiple number of machines with multiple features. Every machine has its own features and application, and you have to choose what is your practice, what are the levels you want to go with, how much you are comfortable with, and you can choose the best option for you. So this is the best advantage of going with open system. Okay, the open choice from my side is the next generation Lyra mill, which is the most simplified milling machine I have come across, and it looks very elegant in your clinical setup and has been specially developed for clinical setup. So it's easy to use. It has a same system like you have in your cartridge and burr, so one burr, and first it can mill most of the materials, most of the uh, newer generation materials, so that you can give your restorations to your patient immediately without doing lot of post processing. So once you have scanned, you have milled, then done little bit of polishing, staining, and it is ready to go. So this is what the future or the present of digital dentistry. To be able to do certain amount of work in-house for immediate, quick treatments and theater work, you can always collaborate with your laboratories, existing laboratories, newer partners, uh, specialized partners. So you know you get the best for your patient. Here is the various open machines available. Programming from Ivoclar, Vivadent, and then C series from Strawman, PL from I think it's another company. Then these are Roland, and this is Lyramin. So Lyramin, as you can see, is able to perform most of the materials which are clinical materials. So you can be assured that once you have this mill and you are using it, you can go through the whole spectrum of the materials available right now for clinical CAD/CAM. Mill integration is done by internal validation. We have done a lot of testings also. So once all this is done, then only the machine is called as trusted connection. So Lyra Mill has been validated with 3Shape for their CAM software and their outputs. So 3Shape validated by for a trusted connection and the support of wide materials. You scan the design on 3Shape CAD, and you can have a CAM which is integrated by 3Shape and do the milling. The machine is very affordable, also cost effective, simple and easy, and is made in France. Of course, if you don't want to do anything in-house as far as production is concerned, then there are 20,000 labs network with the 3Shape. So you can choose as many as you want, and you can send your data for all these applications anywhere in the world. So with this open architecture, with 3Shape communicate system, you are connected with the world. You can just create world-class restorations in your office, or you can collaborate with world-class laboratories to give you the best option available. The advantage of this is it will give you access to all patient cases everywhere in your clinic. Team-based approach. You can have scan in one room, you can have design in another room, and you can have a milling in another room. So all these things creates a one-piece solution in-house. So you have an open ecosystem, and you can send the data as well as to the different laboratories. Now we will see how digital implantology is simplified with digitization. So with the use of Lyra technology, you can see the video. This is a major revolution. So in this case, if you choose to place the implant, you can place this profile designer simultaneously, allow it for healing, or you can take a scan and give a temporary restoration. These profiles are available for all the clinical situations, premolars, anteriors, and molars. The traditional protocol versus iPhysio protocol is advantageous because in this case, you will have no removal of your profile designer. Every time you remove your healing gap, you put your impression post, you put your abutment in, all this leads to the distortion of hemidesmosums and connection between the soft tissue and the bone. So this is a one-time solution for your implant restorations. May it be single tooth, may it be bridge, may it be multiple units. These are zirconia coated titanium, so they are very safe and loved by the soft tissue. It creates a continuous emergence profile because you have various colored screws for different gingival heights. So 1 millimeter, 2 millimeter, and up to 4 millimeter you can have, and is available for all major brands. So digital dentistry is not only for crowning bridge, it's for simplifying implantology. Firstly, by using Implant Studio, you can create your surgical guide. Once you have created your surgical guide, place your implant. Further, it simplifies the digitization of your process. So every step, the digitization makes it more easy and uh, comfortable for you as well as for the patient. So these are various profiles available, and they are available for almost all the major brands in India. These are some of the cases we have used these profiles, and we found that those are the most simplifying lot of efforts we put to create implant restoration. This is cemented single unit implant restoration, where this IPGO is placed along with the implant, allowed for healing. Now the scan is made. You can see the scan, the IPGO profile is very clearly seen. In the software, we will have a corresponding iPhysio CAD, and then we can create a customized abutment using abutment designer software. Mill that abutment and The customized abutment is placed and the crown is cemented on the customized abutment. Now this is the way how we were going one step at a time. So the same thing for even bridges, the posterior maxilla, two implants, and you can see uh, combined units of zirconia and custom abutments. These are all cemented. Nevertheless, even if we want to create a screw retained restoration, so these are small restorations, and with the number of years of experience, we have seen that majority of the restorations are today getting smaller because of implantology. So one case at a time with one implant, we have eye physio in place, with the soft tissue healing. You can see the X-ray. The profiler will give you a nice emergence profile of your crown, customized abutment, and crown integrated. So now you have a screw retained abutment, which is further placed in the mouth, and you can cover the top with it. So this material which is used is called as hybrid ceramic. So this is a very latest material which can be modified in clinic to certain extent. If even if there are high points or if there are some issues with the occlusion you check, you can grind them, finish polish them in clinic. It need not have to go back to the laboratory for again to do so. It reduces your time of delivery and it's permanent. So it's a very beautiful integration of material technology and reduces the time. Again, a screw retained bridge to implants in the posterior. They are retained with the screw, and you can see that the implants see the healing of soft tissue. Because of the profiling, you will never ever have a soft tissue engagement. How many times you say we have seen that in the second stage or even while we are placing our final crown, this blanching of the soft tissue. There is the patient says it is hurting me around for some time at least. And that's where we are over pressurizing soft tissue. So this conditions the soft tissue the way you want to have the emergence of your crown, and also it helps in detecting your implant while scanning because the scan at implant level is also important. So this overall helps in creating a more natural and uh, not only beautiful but also balanced restoration, physiologically balanced restoration. Of course, you can adjust some occlusion high points and you can see the bridge in place. So if you want to learn more, we have online learning hub. There is one is to one online training, and there are training materials. Also, full workflow training is will be there very soon. And at I add what we do is we give you we give you trusted advice. We believe in open solution. With our experience and understanding, we can suggest you what best integration or what best technology is suitable for your practice and suggest you the same accordingly. So you can go stepwise into the digital dentistry and don't have to feel that digital dentistry has to be huge or you have to have everything changed because you are doing digital dentistry. Digital dentistry can be incorporated in your existing system with your existing practice, the way you do your practice. So digital is just a better way to do the same dentistry. If your dentistry is good, the digital dentistry can give you better results. But you don't have to just blow up your setups and your things to incorporate digital. So we can suggest you what you should start with, how you should step up, and then get into the open structure where whatever in future you want to integrate, you are open to integrate. Laboratory connectivity, education and integration and support is our main motive at IED, and we will support you during your growth in digital dentistry. Learn more on the T-shaped community. Of course, once you are part of the community, you will have access to various forums. There are knowledge centers and various laboratories. So also you will have inspiration by getting insight into the way how international things are done and not get limited with what we are having today around us. So think big, think digital, create local, and go to the world. So events and exhibitions are the part of it. Please connect yourself with the community at .3shape.com, community.3shape.com, and you will be able to access lot of knowledge and understanding with digital dentistry. Let's change dentistry together, one step at a time. Thank you all. Thank you for your patient listening. And I'll be happy if you have any questions regarding anything. Thank you.
Wow, the very controversial question and the very common question. We start with the first question. How much does a good intraoral scanner cost?
Yeah, that's very interesting question. See, the cost is one thing, and today with all the management systems in the market, you can choose how you want to work around with it because you can avail a
Dr.
scanner.
Karthik, can you be a little louder?
Okay, okay. Yeah, you can avail a scanner at say minimal deposit, and you can collaborate with the laboratories to support your restorations. So that way your cost of scanner is reduced. That's one way. The another way is if you are dentist and you are MSME, you can very easily avail the financing for this kinds of equipments today because thanks to a lot of schemes to support the dentist, and then you can utilize the facilities. Now reducing the cost is one thing you have to choose. You can choose your provider. They have various schemes.
Doctor, can you please talk loudly? We are not able to
Yeah,
hear. You can keep the mic close to you.
yeah. You can use various providers who can support you with the lab support, and you can reduce the cost. But the cost of this scanner would be depending upon the features you are selecting. So there are scanners with basic features and basic software. Then the scanners are with better features, and then they are the best ones. Like the Trios 1 Basic is just a black and white scanner where you will not get lot of support for designing. So you can start with only scanning with that. Or you can go with Trios 2 colored wired, which will have a reasonable software support along with the scanning. And then if you want to upgrade, you can go to wireless ones because the better the features with the scanners, they are incorporated with better working efficiency. So you can use it for implants, for cross arch, for full arch cases, for denture cases. So That way you can use it for higher revenue generating kind of restorations. And if you want to go beyond that, to use your scanner as a diagnostic aid for your preventive dentistry and increase the database of your patients, like future patients to be incorporated today. So diagnostics and preventive is the way to go in future. The less you harm the natural tooth, the better restorations you can get. So to begin with, you can start with a basic scanner and then eventually upgrade along with your additional experience.
Thank you so much, sir. We move to the next question. Which company, which type of intraoral scanner has the best quality and all included features?
Reshape.
3Shape, always and forever.
Yeah. So all the features which are there in Reshape 3 or 4 are beyond what you would expect from a scanner, because the diagnostic feature which they have, the fluorescence test which they have, so all these things are eventually leading to use scanner as daily equipment. Like you won't go ahead without scanning a patient, because once you scan the patient, you can analyze the case more in depth rather than just observing with your naked eyes.
Thank you,
So
sir. We move to the next question. How do you justify a scan, taking a scan in these COVID-19 pandemic era? What kind of sterilization protocol is followed on the tip of the scanner?
yeah, it's a very interesting and very good question to the pertaining situation, because see, in an analog dentistry, we use impression materials. Now they come in very close contact. In fact, go sub-G level also. So there is more chance of contamination and cross-contamination with analog impression method. On the contrary, with scanning, it is a touchless. It's a touchless impression. So you're not touching anything virtually, and you are moving your wand from the intraoral cavity just on top of the teeth, or you avoid touching anything in the intraoral region. Secondly, the tips are available, extra tips are available. With each scanner, you may get up to 5 tips, and these tips are autoclavable. So once you finish one case, you have to autoclave the tips, and you have to also cover the body of the scanner with suitable cling material so that you don't contaminate. Scanner should not be autoclaved. Only the tips can be autoclaved.
Only the tips can be autoclaved. That's
Yes.
right. Correct. We move to the next question. Sir, unfortunately, I feel 3Shape uh, doesn't really have all included features, and every year the software needs to be updated with a special amount. Is there anything that can be done so that we can include everything once and for all? Because I don't want to invest after every year.
Uh, yes, you can do that. If you buy the best scanner, it comes with all the software. And as far as every year subscription is concerned, there are certain products with 3Shape which have lifetime subscription. So if you go for old generation scanners, now they are providing them with lifetime subscriptions so that you don't have to subscribe every year. And this is the trend which is followed. Till now, the subscription was or is a good way to remain connected with the company, and as it develops, it charges you. Now, if you don't want to pay for the subscription, then you get limited with your hardware and software at that time and cross section of uh, say date. So you will not be able to use the better features out of it. Anyways, lifetime subscription is possible now.
Thank you so much, sir. We move to the next question. I think this should be the last question. Good question once again. Uh, Dear doctor, it was a wonderful presentation. I think you've given us one of the best insights on digital dentistry. My question to you is, I don't have a financial capacity to buy a very expensive scanner. Can you suggest us beginner level scanners like Launka scanners or any other scanners from countries like South Korea, which are doing good in the Indian market?
See, I understand your situation, and that's the situation throughout the world. Everywhere, everybody wants to reduce on the investment, but you have to uh, wait because these are new technologies. Only companies who are uh, experienced with this product can give you consistent product. So I would suggest whenever you choose a low cost scanner, uh, you can choose a low feature scanner from a better company rather than choosing a low cost scanner, because low cost scanner will not give you the output results, because it's like garbage in, garbage out. If your point of data acquisition is not of superior quality, then whatever you design in your software and whatever machines or material you use, you will get that inferior quality results. So nevertheless, there are now and in future also better and better scanners coming from other countries. So please evaluate, and you can choose. Uh, they should give is STL filer. That's all. So you can use all the scanners. That's okay. You should do it digitally. That's all.